It was something many of us will never forget. It was 5 years ago that the world came to a standstill over the COVID-19 pandemic.
Hard to believe. And for many faced with the impact of long COVID, they're still continuing their healing journeys. Tonight, our Simon Shaykat is talking to one man who is battling back 5 years later, learning about his daily routines as he struggles to get over the virus.
Simon also has more on resources available to people in the same situation.
Today, a survivor of long COVID is sharing his journey with me, including his battle to regain his strength 5 years later.
I take an average of 20 to 30 pills a day.
As a proud Detroiter with a passion for music, Arliss Swacker, who's also a distinguished military vet, knows how struggle can become isolating.
I don't involve myself too much in conversation because I'm going to use the wrong word. I'm going to mispronounce a word.
The father and grandfather, who's made a long career as a DJ, sat down with me to talk about COVID-19 5 years after he says his life changed permanently and numerous threats to his health surfaced.
How do you best describe long COVID 5 years later?
I had to have a quadruple bypass surgery. They discovered that I had prostate cancer. There's no feeling right now in my left hip.
Arliss tells me a 4-month hospitalization involved going through a series of health problems, from kidney issues to cancer to brain fog.
God said to my daughter, "You don't have to worry about your father. Your father's going to be fine."
His story, all too familiar to experts like Dr. Catherine Siegley, who is co-director of the U of M Health Post-COVID-19 Clinic. U of M Medicine has shared data that 10 to 20% of those infected have lingering symptoms such as spine or back pain, insomnia, depression, fatigue, chest pain, shortness of breath, and more.
When our clinic first started back in, I believe it was early 2021, we really performed a lot of medical tests. We've really shifted away from that approach, which I think, patients didn't find particularly helpful, into more of the physical medicine and rehabilitation approach.
At U of M, a care model overseeing a recovery group is making a difference to help with rehab and to improve quality of life. Reduction of symptoms and re-engagement in life among the top goals.
And using evidence-based strategies to gradually re-engage in those activities.
For thousands of patients like Arliss Swacker, hope is at the heart of healing.
Get good advice. Don't assume. Don't try to outthink the doctors.
For more information on resources that are available, you can find a link on our website, WXYZ.com. From Midtown, Simon Shaykat, 7 News Detroit.
I remember doing stories on long COVID when people had no idea what long COVID was. I mean, just amazing. We all talk about what it was like.
And our hearts go out to those people who are still suffering.
Absolutely, yes. Have patience, and I know the struggle is real.